Figures gathered by BBC Look East show that there are more than 400 nursing posts vacant at hospitals around our region. In some cases, managers are trying to actively recruit, but there still remains a national shortage of nurses. So why can't we meet the demand? Well, we've been to Addenbrooke's, a hospital that admitted to us only last week it was struggling to cope with critical staffing levels in A&E. Louise Hubble is at the hospital for us now. Louise.
Amelia, I've spent the afternoon on one ward here, nurses working 12-hour shifts.
Throughout Addenbrooke's history, nurses have been at the very heart of the hospital. Although A&E may have changed a bit, the challenging hours and the physical nature of the job has remained the same. But now more nurses are needed than ever before. Here on the trauma and orthopaedics ward, the numbers on shift must meet government guidelines. It's a constant struggle to reach them.
So a combination of our ageing population and the increased care needs we're seeing from our patients that are coming through our doors is that we need more and more nurses, and it seems that they are ever increasing in the numbers that we need.
Often there is a shortage of more experienced, specialist staff than the newly qualified ones. And one of Addenbrooke's 2,700 registered nurses identifies what may be a factor here.
Obviously, like London, the house prices are can be quite expensive. But for me, I think if you want to work in a really good hospital with lots of learning development opportunities, then you pay the money.
I contacted all of the region's hospitals to ask for the current number of vacant nursing posts. Some are being actively filled, but Addenbrooke's had 31, Peterborough City more than 40, Kettering Hospital had 70, and the Luton and Dunstable over 100. Now many are turning overseas.
6 of the region's hospitals, including here at Addenbrooke's, currently recruit nurses from Spain because of their high level of training, and 7 paediatric nurses will soon be starting here from Scotland.
One Lithuanian nurse can understand the attraction of working at this teaching hospital.
It offers me a professional development as a staff nurse. I can do different courses with university as well as in the hospital and develop professionally.
More nurses are needed and more hospitals are looking further afield to find them.
Well, apologies for the technical problems there. Increasingly, hospitals are conducting formal recruitment programmes overseas to try and attract the brightest stars. And that looks a trend that's set to continue. Amelia.
Thanks very much, Louise. It's one of the fastest growing citizens